This is our pathogen project. My name is Leah Dornak.
My name is Tiana Scott.
This is our pathogen description. So streptobacillary rat bite fever is an infectious bacterial disease that people can contract from contacts with rodents, specifically rats. It is a disease transmitted from animals to humans caused by aerobic gram-negative bacterium Streptobacillus monoiformis, and it is transmitted to humans through the bites and scratches of infected rats and in some cases other rodents. Streptobacillus monoiformis is a gram-negative bacilli in chains and clumps, non-motile, rod-shaped bacterium that is a causative agent of streptobacillary rat bite fever. Now, thrush is a fungal infection. Oral thrush will appear creamy, white patches or red sores. The species responsible for thrush is Canadian albicans. The genus is Canadian and the species is albicans. Canadian albicans is a fungal gram-positive organism typically forming in clusters.
Now, for the signs and symptoms progression if untreated for streptobacillary rat bite fever, symptoms include fevers, rash, and joint pain. If left untreated, it could possibly cause sepsis. In some cases, streptobacillary rat bite fever can cause death. For thrush is most common in babies under 1 month old, adults over the age of 65, and people with weakened immune systems. A common sign in the presence of creamy white, slightly raised lesions in your mouth, usually on your tongue or inner cheeks. Thrush can spread to other parts of your body if left untreated, including your lungs, liver, and skin. This happens more often in people with cancer, HIV, or other conditions that weaken the immune system.
Now, what is the route of transmission? Transbite bacillary rat bite fever is passed to humans through bites and scratches of infected rats. This disease is found worldwide, but the exact incidence is unknown. Thrush can be transmitted through contact with infected areas such as mouth, vagina, or nipples, or through kissing.
What type of treatment is available? For thrush, healthcare providers usually prescribe antifungals to treat thrush. Usually you need to take these medications for 10 to 14 days. For streptobacillary rat bite fever is primarily treated with antibiotics. The first line treatment is intravenous penicillin administered for 7 to 10 days, followed by a course of oral penicillin.
Historical and current prevalence for incidence of the disease. The incidence of streptobacillary rat bite fever is reported to be 10%, and estimated 20,000 rat bites occur in the United States each year. An estimate of 25,000 cases of chlamydia occur in the United States each year.
Oral thrush occurs equally in male and female. It typically occurs in neonates and infants. For streptobacillus rat bite fever, most cases occur in Asia, but it has also been seen in the United States, Europe, Australia, and Africa.
Now here's some, this is an outbreak that happened. It happened for streptobacillus rat bite fever in Haverhill, Mass in 1926. It was an epidemic in England in 1983, was also associated with ingestion of raw milk contaminated by rat feces. 304 individuals were actually infected with this disease. Now for thrush, in 1940, there was an increase in fungal infections as antibiotics often disrupt the balance of the normal microbial flora in the mouth and other areas of the body. This created an opportunity for fungi to overgrow, especially in hospitalized patients. While the exact number of people affected by thrush at that time is not readily available, studies have indicated that thrush became a frequent concern in hospitals, particularly among neonates, elderly patients, and those with weakened immune systems.
For interesting facts, for streptobacillary rat bite fever is diagnosed by growing the bacteria from blood or joint fluid sample. The lab should be told in advance so they could use the right materials to help the bacteria grow. Special antibodies usually appear in the second or third week, and rising levels can help confirm the diagnosis. If thrush extends into your esophagus, your healthcare provider might take a throat culture, which is a swab of the back of your throat with a sterile cotton, and study the microorganisms under the microscope. Perform an endoscopy of your esophagus, stomach, and small intestine.
Any questions? And here's our references.